Hi, this is Dr. Peter Butkins. I'm owner and director of My Freedom Quest, a drug alcohol treatment program in the Central Florida area. We're a little bit north of Orlando. We have a good success rate. I teach what I believe and I do what I teach, and I've been doing it over 45 years, so I'm getting the idea of it. I'm pretty sure I know what works, and I ask people to get involved with me and follow my lead. You cannot you can't be successful if you're running the show. And that brings me to the purpose of this video. This video is for the family or the spouse, significant others in the lives of an addict and alcoholic who are seeing the problem and want to get the person in treatment. I've had real good success when I work with a family. When I was in graduate school back in the 80s, I was at a cooperative doctoral program at the University of Central Florida, University of Florida. There was a doctor by the name of Robert Beavers who came out with a program and a book on successful families. His book was told you what made families successful, and it was one of the first books in the field that really told you what works and didn't analyze what you were doing wrong, but it just kind of pointed us in a direction. And I've taken stock of that over the years and realized it's really important to know what works. What works for drugs and alcohol is getting the family involved in getting the addict or alcoholic to feel the consequences so that they're motivated to do what it takes to prioritize recovery. They've got to be motivated through the pain and consequences in order to really want to stay sober and clean. If there's not loss, the person keeps using because the cravings are and the mental obsession is so incredible with this illness that it's really difficult to overcome. And yeah, I said illness. It is a disease. There's a pregenetic disposition. There's chemistry involved with the prefrontal cortex, the prefrontal lobe of the brain secretes serotonin, which is a reward that most addicts and alcoholics go for. So there is a reward system set up. I don't want to get into the medical aspects of addiction, how the drug hijacks the brain, whether it's alcohol or anything else, but just trust me, that's something we teach at the program. So there are consequences that addicts and alcoholics need to experience. There's a lot of events that precede the bottom. The bottom is the consequences, and Skid Row is a mindset. For a lot of people, the bottom is hangovers. For some people, it's the brother crying and saying, you know, please stop. For others, it's the parents saying, I feel like I've lost my son and I can't subsidize this anymore. But the consequences are either natural or imposed. Natural consequences happen as a result of using, and they're what goes on in society. They're natural consequences. You drink enough alcohol, you're going to get gastrointestinitis or an enlarged heart, or you're going to have stomach problems, you get ulcers, or you'll develop some kind of problems with the liver or the pancreas, etc., 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 and let alone the brain damage that occurs when people ingest huge quantities of alcohol or drugs over a period of time. So the consequences are natural. The other consequences that occur are legal, mental, emotional, physical, spiritual, career, education, job, financial, primary relationship with spouse, relationship with the parents, relationship with children, siblings, etc., etc. It goes on and on. These consequences are usually covered up, or someone pays the lawyer, or they get the person out of jail, or they buy a new car, or they cover up the consequences because they want the child to be successful, or the spouse. And this is just unintentional enabling. It's not something we do because we don't like the person or we want them to keep using, but that's what happens, is the person now is able to keep using because we have a very difficult time detaching and enforcing consequences. So that's what we teach at My Freedom Quest. We show you, we have classes where we actually role play and teach what to say, how to say it, when to say it, and why it's so important to do it. We also have people come in and say, we've done this and it's worked. So we have a way of doing this that is kind of the opposite of what we learned growing up about how you're supposed to provide and protect your family and save their lives. When it comes to addiction, the training we get, the program we get for parenting usually doesn't work. It takes tough love. It takes setting boundaries and sticking to the boundaries and not caving. And as I said, the family has to get healthy enough so they can do this. You can't do it if you've let it go on too long and you're real angry, or you can't do it if you haven't let it go on long enough for you to really feel the consequences imposed on you. If he's drinking or using and you're getting the hangover, it's gone too far. It's interfering with your family. And sometimes you do have someone in the family that's causing a major problem. You have to protect your family above all else. The good news is this works. When you start taking care of your family and taking that one person who's sabotaging the health of the family and setting boundaries and letting them know you can't do that in your family anymore, and there's rules now, there's a new set of rules, the person then has a chance to get sober and clean. Again, my name is Dr. Pete Butkins, and I care. My purpose in life is to stop the drug alcohol problem on the planet, and I'm going to put a dent in it before I'm gone. You can call us at my Freedom Quest, 407-786-1913. Real glad you listened to this. I hope you heard something that was helpful, and God bless. Thank you.